So where do you intern?
I intern at the UK Chandler Hospital. Sometimes I also go to Good Sam Hospital, which is over by North Campus, but those are the two main hospitals. I'll do a little bit in the Kentucky clinic too.
And so what do you do when you're interning there?
Well, I'm still a student at the University of Kentucky, so I can't talk to any patients through the mode of interpreting, so I just shadow interpreters and I go with them to appointments. I go with them from appointment to appointment with patients when they have to take them to appointment, so I just shadow.
Okay, and what types of medical interpreters are there? Like, we've studied things like there are chance interpreters, untrained, trained.
There's several types at the hospital. The most common are trained medical interpreters who are professionals and they have certifications. They usually work the 8 to 5 hours Monday through Friday. The hospital also has translation phones, so you can call an interpreter at any point of the day. And then this isn't really supposed to happen, but it ends up occurring. Sometimes doctors will use younger children, family members, and things like that, ad hoc interpreters to interpret for patients, which really shouldn't happen at all since we have an interpreting program, but sometimes it ends up occurring.
So what kind of issues can occur when you use children as interpreters?
There's all types of issues. They don't know a lot of the medical terminology, so you end up getting an imperfect translation, or sometimes the translation doesn't even make sense with what the doctor is trying to convey. So basically using a child or a family member is really a bad idea.
Okay. And what is the main role of interpreters there?
Following the conduit model, they are just supposed to interpret verbatim, so that's the main job that you'll see. One thing that I notice a lot is they have to play the advocate role, as in sometimes Spanish or ELP patients, limited English proficiency patients, they need help maybe getting their medicine or finding financial means to pay for their treatment, or maybe even just help finding the next appointment. So there's a lot of ins and outs and little things that interpreters have to do to make LEP patients' experience more smooth.
Okay, and what are some of the main challenges communication-wise that you notice?
Sometimes, there's challenges between doctor and interpreter. Those are less common. What I would say would be the most tricky thing is there's so many dialects in Spanish. I mean, you can name Spanish-speaking countries and then multiply that by however many dialects there are in each country. So there's a lot of variance in vocabulary. The word to say, hematoma might be completely different in Venezuelan Spanish than it is in Colombian Spanish, and it might be different in a part of Venezuela compared to another part of Venezuela. So there's a lot of variability in the language and terminology.
Okay, what mistakes have you noticed to occur most often?
I would call it editorialization, and it's not really a mistake. What it is there's certain phrases and idioms and phrases in English or Spanish that don't translate verbatim and don't translate well. So you have to work around it and use a phrase that means something similar in the other language to convey meaning. So while it's not verbatim translation, what they are doing is working around and using different words in different languages to mean the same thing. So I wouldn't call it a mistake. It's more of working around the strictures and constructions of languages, because not everything is always going to translate word for word. So you have to be a creative thinker to get around that.
Does technology play a role in interpretation? Like, do you guys have interpreters that are like on Skype and telephone and stuff like that?
Well, the first thing there is they always call the interpreters on pagers and things like that. But then if there's not an actual real physical interpreter available to do the work, they have phones. They're Sericom phones, in which there's actually two phones, one for the doctor and one for the patient, so they can both listen and talk at the same time. And then for people with American Sign Language, they do have video interpreters. So yeah, there's a lot to do with helping people get help people get treatment when there's a language barrier.
Okay, and my final question for you is, we've done some reading and we've heard that not all interpreters are required to have training. Do you think that they all should require training?
Well, that's true. It just depends upon where you are in the world, how much training they'll ask for. But I think there should be standards for training, because in reality, the job of an interpreter is just as hard, if not harder, in some situations than the job of a doctor. So the people who are interpreters, there must be high standards for these people because they're doing something that's really cognitively challenging day in and day out. And just to have somebody who would, just put forth a half effort or not a full effort, that's not acceptable, especially when there could be lives in the balance. So yes, I think training and certification should be necessary for interpreters.
Okay, awesome. Thanks, John.
Hmm?